Hi friends, I am Dr. Pratap. I have done MD in Forensic Medicine. Today we'll discuss about medical legal aspects of firearm wounds. In this we'll discuss about scene of crime, examination of scene of crime in firearms, collection of evidence in scene of crime, and also the medical legal questions which arise in the firearm wounds. First, coming to scene of crime, first we have to take the photographs. In photograph must be taken from different angles of to show relative position of various items. It may be related to a body as well as all the blade wounds all has to be noted with different angles. Then photographs of the cartridge case or bullets which are present, empty cartridges will be taken out. Bullet holes in cases like in walls or in case any place other than the body if they present bullet holes on the body has to be taken, and photographs of the body has to be taken in different angles. Next, photographs of entrance wound, exit holes should be taken. Photographs of bullets, pellets in case of shotguns, wadding in case of shotgun if it is found in the body has to be photographed. Fingerprints on doorknobs, glassware and weapons has to be photographs. Collection of evidence from the scene. There we have to collect the gun if it is found, then fired bullets, how many bullets have been fired has to be taken, evidence is collected. Empty cartridge cases found on the scene has to be collected. This will tell the number of bullets fired. So number of empty cartridges will be equal to number of bullets fired. Empty shells in shotguns or barrels should be collected. Hairs, fibers, blood stains found in the scene of crime has to be collected for analysis. Objects struck by or containing spent bullets, like in case of if the bullet has struck some objects like in the wood or cement in the walls, the bullet may leave some trace evidence on those objects which has to be collected. Glass shattered by the bullets has to be collected. Areas showing any fingerprints or footprints has to be noted down on collected using any POP materials. Then from suspect, we have to collect the clothes of his suspect and with trace evidence. Victim's hair, clothing and fibers and blood stains if found on the suspect has to be collected. Gunpowder and other evidence on the hands. From the hands, in many person when firearm is fired, there is chances that gunpowder will be deposited in the hands near the elbow, usually near uh, the thumb, which has to be collected. Next, we have to collect the firearms if it is found on the scene of crime. If there is a firearm is found on the scene of crime, we have to find where it was found, when it has to be collected. We have to note down where it was found, whether which type of weapon should be noted down. Then, if there is any presence of any marks on the bullet butts or frames of the weapon has to be noted down, which will help in identification of the person who has fired. Then, afterwards, which weapon should be sent for forensic laboratory for further analysis. And lastly, we have to collect the unspent ammunition if it is present or empty cartridge presence in the weapon collected. Then coming to autopsy. In autopsy, first we do the examination of the cloth. In case of firearms, it has to be first the clothing is removed from layer by layer. Then we have to list all and note their condition and extent of blood staining on the clothes. Then record the number and location of bullet holes. So bullet holes has to be recorded, whether it is entries or exits has to be differentiated. The holes in the clothing should be connected to the tissue in the body. So if it is present on the chest, it has to be correlated with the body itself, whether it is correlates or not, to determine the direction of the firearm. Next, the clothes should be preserved carefully in a brown paper or clean plastic bags and sent to the forensic laboratory for further testing. Examination of clothes usually helps in determining roughly the range of firearms if it is fired. Mainly times, in case of if the person's body is clothed, the unburned particles will get deposited in the clothes, like soot particles, tattooing will be seen in the clothes, which help in determining the range of the weapon. It also helps in determining defects or of wounds of entry or exit. Also, to locate the bullet. Sometimes, after exiting the body, the bullet may stuck in the clothes and it may be found inside the clothes. Next, you have to examine in autopsy the bullet wounds. So, on the body, the diagram in the body diagrams of in the autopsy report, the wounds should be drawn correctly as they appear in the body, including any case of burning, blackening, or tattooing or abrasion color if is found on the body. This all will help in estimating the roughly the range of the weapon. Photographs of the wound should be taken. Then we have to describe the bullet wounds. So bullet wounds has to be described with the exact location of each wound, which should be noted in relation to its distance from the top of the head or sole of the foot, whichever it is nearer. Then we have to describe the distance from the midline of the body. Then with the fixed anatomical landmark has to be described. For example, if the firearm wound present in the chest, like in the chest, we have to tell in the chest 50 centimeter below the head of the below the top of the head, 8 centimeter from the left of the midline, and 2 centimeter from above the nipple. So first we have to describe with the top of the head or heel or sole of the foot. Then we have to mention the distance from the midline and with the any landmark which is present near the body has to be described. So exact location will come to know. Then external wound of the blood wound has to be described, like character of perforation, how it is shaped, like it may be stellate shape, which tells that it may be a contact shot, it may be round, slit like or irregular shape, and size, exact size on based on the length and breadth has to be noted. Presence or absence of blackening, tightening should be specifically noted, which will help in estimating the range. If it is skin is flat, whether it is contiguous or non-contiguous has to be noted down. Presence of muscle print, soot deposition, including the corona around the wound, has to be noted down. If any metal deposition is present on the interest wound, has to be described. Then we have to describe the bullet track through the body. So as the bullet enters the body, it usually forms cavitation, and as it enters, there is a huge damage occurs in the surrounding tissue. So this track has to be noted down to find the bullet which may not be have been exited from the body. So this will help in determine the exit wound if present, or find the bullet which is present in the body. Bullet tracks should be numbered and described individually for each individual bullet holes. Rope should not be used whenever in the tracks, because it may disturb the track, as well as it may will be difficult to afterwards will be difficult to determine the range. The part taken bullet through the body should be carefully traced by dissection with the organ in situ. If the track is inside the organ, the organs has to be described in situ only to know whether that is a track. So in situ only the organ has to be dissected, and the track has to be noted whether how the bullet has traveled to the organs. This also has to be done in the similar to in the all the cavities, like the abdomen cavity, chest cavity, if it is present, has to be tracked. It is useful to measure the height of both the entrance and exit wounds from the undersurface of the heel to know the position of the body. So always it is better to know the measure of the height of the bullet, both entrance and exit from the height. So if the entrance wound is present in the chest and exit wound is present near the pelvic regions, so it tells that the person was sitting in a direction, or the bullet was fired from the below direction, or if the person was sitting in such a way that the bullet has entered from above downwards. It is also helpful to describe the wound in relation to the plane of the body, like below upwards, above downwards, like that. To avoid prolonged search of the bullet, it is advisable to take X-ray examination to find all the bullets. This is very helpful in case of shotguns where multiple pellets may be found in the body. In case of brain, where the brain which has a hollow organ which consists of brain, many times the track may damage, which is 4 to 5 times the diameter of the bullet may be found. There is prior cavitation of the bone, and which may result in the skull fracture. If the fracture extends beyond the area of the entrance and exit wound, the cavitation is very severe, and which may lead to burst of the pressure of the brain. Large portion of the brain may be torn out of the bursting skull and found intact, which is called as Conley shot. So many times, very difficult to track the bullet inside the skull, and because of cavitation formation, as well as many times the skull may fracture and brain may come out of the fractures. The things which has to be preserved in case of firearms. First of all, bullets, pellets in case of guns, cartridge cases from the scene of crime, fired bullets from the other than the body, slugs or wires if it is found, then clothes. So these all things has to be preserved in a clean paper and clean polythene pack or sheet of paper and sent for forensic science laboratory for further analysis. Next is medical questions which has to be answered in case of firearms. First is the injury caused by discharge of firearm? So whether that injury, so all the circular wounds may not be firearms. So the circular, if the wound is a circular, which has to describe whether this wound is of firearm or not, which has to be decided first. So this can be decided by presence of soot particles, gunpowder particles, or other than that. Then we have to know whether what type of weapon was fired. So in case of firearm, whether it is a rifle or it is a shotgun has to be described. So if it is pellets, then it is shotgun. If it is single bullet, it is a rifle. So from what distance the direction was fired? So direction and distance can be described based on the tattooing, soothing, also by presence of abrasion colors. We can tell the direction. As well as bullet track in the body can helpful in deciding the range as well as the direction of the firearm. If multiple wounds of entrance and exits are present, which can be produced by single bullet. So this can happen many times because of the position of the body. So once the body may enter from the hand, it may enter and exit from the hands, enter the chest and exit from the other end of the chest, exit from the body, which has to be noted. Then if multiple wounds are present where they produce from the same or different weapons. So each wound has to be examined clearly to know whether one is firearm, other may be caused by stab injury, may be also be found. Then we have to know when the firearm was discharged. So this can be done by different tests like paraffin test or Dermanata test, Harrison-Guillory test, neutron activation analysis, atomic absorption spectroscopy, scanning electron microscope. So these are different tests available to know the residues which are left from the bullet. So this can be analyzed from this test. Then how long the victim was survived. So if with the firearm, sometimes the person may not die immediately and may survive sometimes. So if the person may have moved, then there will be presence of blood stains will be present in the scene of crime. So how much he has survived. Then how much activity the victim may be performed following the injury. So this can be again determine where was the firearm wound was present. If the firearm was present, a wound is present near the limbs, the person may able to move few centimeters or few meters. If it is present in near any vital organs, the person may die immediately. So based on where the wound is present, it can be determined. Lastly, in case of whether the wound whether the wound is of a homicide, suicide, or accident has to be known. So this can determine the position, direction of the wound. So in case of suicide, it is mainly present in the temple region. Accidental wound may be present in anywhere, and usually homicide is also present anywhere in the body. Nature of entrance wound. So mainly the suicidal wounds are always contact shot. Accidental and homicidal are always, it may distance may vary. Number of wounds. So when many times suicide is mainly single entrance wound present. Homicide and accidental are, it may also will be only single. Accidental will be single. Homicide will be it may one or it may two. Position of the weapon. It may be in suicide cases, it may be held in case of suicide, but it is not held by the person in case of accidental. So it may be held in accidental, but not be present in the hands of a person in case of homicidal. Motive is present in case mainly in the homicidal. Suicidal also some case of depression may be seen. The scene of crime will also help for differentiating between the homicidal, where it will be scene of crime will be disturbed, but in case of accidental or suicidal, it will not be. It will be same. Sex based on males, mainly the suicidal is common in case of males, but it's not so common. It's not so reliable. Then how the body has been disposed will also help to determine whether that wound is suicidal or accidental or homicidal. These are my references. Thank you.